Good afternoon, everyone. I'm grateful today to be able to introduce New Hampshire's own Governor Kelly Ayotte. As a lifelong Granite Stater, Governor Ayotte knows we live in the best state in the country to live, work, and raise a family, and she will work hard every day to deliver for all of New Hampshire. Growing up in Nashua, Governor Ayotte learned the only way to achieve success is by working hard. Her first job was bussing tables during the summer at Mame's Restaurant in Meredith. She worked her way through college, receiving a Bachelor of Arts with honors from the Pennsylvania State University and her law degree from Villanova University. Governor Ayotte has dedicated her life to public service. As a murder prosecutor, New Hampshire's first female attorney general, appointed by a Republican governor and then reappointed by a Democratic governor, and as New Hampshire's United States Senator. After her service in Washington, Governor Ayotte worked with a number of New Hampshire companies, including BAE Systems and nonprofits like Veterans Count and Swim with a Mission. Governor Ayotte still lives in her hometown of Nashua with her husband Joe and two children, Kate and Jake. Governor Ayotte knows that we must strengthen our mental health care system to help Granite Staters thrive. In her proposed budget, the governor is calling for $10 million to fund uncompensated care at our community mental health centers and fully fund our state's recovery-friendly workplace program. In addition to funding these important priorities, the governor is committed to working with our community colleges and university system to train our mental health workforce of the future and increase the number of providers here in the Granite State. Governor, we are so pleased to have you here to share your vision for building a healthier New Hampshire.
Hey, thank you so much, Susan. I am really glad to be with you. I'm very glad to be with Michelle and all of your team from NAMI. And I have to say, when I was served as U.S. Senator, I had the privilege of working with NAMI. I appreciate the important work that NAMI does every day. And we got to work on issues like the Mental Health First Aid Act, which I was proud to lead, and also issues like mental health parity. So I know that there are so many ways we can work together because I firmly believe that mental health is obviously as important as physical health. And that, it's critical that people feel comfortable coming forward, that we eliminate any stigma that people have to seeking mental health treatment. And I know how much NAMI works on these issues every day, but it's a constant issue for us and a constant challenge. And so I just want to say I look forward to partnering with NAMI and also the many community organizations that you work with every day on this challenge for the state of New Hampshire. You mentioned already, some of the work that's in the budget. One of the things I saw as I put together the governor's budget is I know how important our community mental health centers are. I also know that they are carrying a lot of uncompensated care in our communities. They're really the safety net, I would say, serving people in our communities that need help. And just this past Friday, I was very fortunate to visit Northern Human Services in Conway and to speak directly with some of their clients who are very gracious and willing to share with me their stories and how Northern Human Services had made a very big difference in terms of the support that they received, not only through treatment, but, really more holistic support in their communities, whether it was housing or other issues that they had to navigate. So I just wanted to say that, one thing that I'm hopeful as we go through this budget process, that the $10 million I put in for uncompensated care that will be provided to our community health centers, that remains present in the budget process. We need to keep our community health centers strong and make sure that they're able to serve every region of our state, right? So the challenges in the North Country may be different, and I know they're different than, for example, in the southern part of the state. And then access to providers, that is always a challenge. So working on those issues, we need to be able to enhance our provider base and opportunities for people to seek help and treatment when they are struggling with mental illness. So I look forward to, continuing to advocate for that. And that's why I included it in my budget. One of the other issues that you touched on in my introduction that is important as well is my budget supported our community colleges. And the reason, and the university system, but I would say especially our community colleges, we want to look at ways, not only in our community colleges, but our university system, of expanding pathways to those who work in the mental health field. And so issues like certificate programs, dual and concurrent enrollment in our high schools to get kids understanding this kind of work and how important it is. And there are some things happening already on that front in New Hampshire. For example, the White Mountain Community College has a mental health technician certificate program. So we want to continue that and build on efforts like that. The Human Services program at Manchester Community College offers various pathways relating to mental health, including programs that focus on substance use prevention and behavioral health. During the campaign for governor, I had the chance to visit Hope for New Hampshire Recovery with Governor Sununu. And one of the things that they pointed out to me, which is certainly something I've heard, from others in the state, is we have to really look at serving the whole person. So many people come to situations, for example, if they're suffering from a substance use disorder, where they also have a co-occurring mental illness. And in fact, we all know that sometimes people who are struggling with mental illness, they are self-medicating. And so looking at making sure that as we're supporting our community mental health system, that we're also supporting sort of the providers that work and making it easier, even in credentialing, to work across together for our providers to have that kind of cross credentialing so that we can serve the whole person. So I look forward to, that's something I feel strongly about, and I want to look for ways for us to do better at that. And then I also would just say that we, thinking about all the work that's done and interaction you have with Health and Human Services, I meet with the commissioner every single week. These issues are important to me. And I would just ask for your feedback on how could we be better, right? We are in a challenge budget environment, but there are always ways we can do things better. And even when I was up at Northern Human Services last week, they are hopefully going to get me some ideas of how we could improve how we get the resources we do have, whether it's federal or state, out to the providers. And sometimes there's bureaucracy in that and paperwork that we want to cut through and make it easier, because I know that when it comes to our mental health providers, they don't have an extra administrator to be able to do all the paperwork, right? That's another position that they can't afford. Or so anything we can do to make it easier for you to serve the people of New Hampshire, I'd love to hear those ideas. I'd love to know how we could make that better. So I would just put that offer out there. One other issue that I wanted to mention that is particularly important also is thinking about our youth and mental health for our youth. And one of the issues that I addressed in my budget that I do hope we do address is the use of cell phones in schools. And I did read the book from Jonathan Haidt, The Anxiety Generation, and I happened to read that during my campaign for governor, and it really hit me on some of the data of how technology is impacting our young people. And particularly the data is staggering that, when you park the cell phones during the day in school, that learning increases, test scores go up, and most importantly, the communication and the reduction in cyberbullying and other anxieties that are created around the use of social media, they go down during the school day. And in fact, I recently visited Claremont School, the Claremont High School, and now they're putting it in the middle school. They did this on their own. Pretty amazing. They showed me their system, and they are parking their phones at the beginning of the day, picking them up at the end of the day. And the superintendent told me it was he's been in education for a while, single most important thing he's done, because they are seeing a reduction in cyberbullying and other things. So we already have a couple of test cases of how this is working in New Hampshire. So another way of thinking about how we can hopefully also improve mental health, but also learning possibilities, something that, you know, I'm certainly pushing. I know one of the issues that has come up in the legislature is also, you know, the survey that is giving all to our high school students on prevention, and also talking about their use of substances, as well as, you know, other issues. And so I do hope, you know, we want as much youth participation as possible. We're never going to force anyone to do a survey, but I know there's an idea in the legislature right now that somehow you should have to opt in instead of opt out. And we know the studies on that will have so many fewer participate. So I certainly don't support that. And I want to make sure that we keep that survey strong so that when we're investing in addressing these issues, that we have good information so that we can figure out, you know, where are the substance use challenges, where are the mental health issues that are arising that are related to those challenges. So I'm hopeful that you know, the House, that will get changed in the Senate. If not, it's not going to be very welcome at my desk. But so those are some of the issues that are happening, you know, right now, you know, in the legislature. I know we're kind of monitoring everything that's happening in the budget right now. I look forward to working with you to make sure that the support for the mental health centers stays in there and stays strong. I look forward to finding other ways to partner with NAMI. And I just want to thank everyone who works for NAMI and also all the volunteers that I know also participate with NAMI and give of their time. Phenomenal group of people. And also the providers. I know that NAMI reaches out to a whole you know, level of provider community that is very, very important to our public health here in New Hampshire. And again, going back to, if I break my arm, I'm going to go to the doctor, right? If I have a mental illness, I need to get treatment and really help. So we need to get that word out. Any way I can work with you to do that so that people don't feel stigmatized, they come forward and they understand that taking care of their mental health is as important as their physical health. And I think we especially feel that after the isolation of COVID, that we know that the challenges have become even greater. And so we have so much more work to do together. And I'm grateful that NAMI exists. And I thank you for your important work. And I know that you heard from the Commissioner of Health and Human Services today. We were commiserating about the important work that the organization does. And we hope that we can find better ways to partner together. And I appreciate your having me today. And I hope to see you all in person too, as well.
So, Governor, thank you so much. And we really appreciate you squeezing us in today. We know it's a really busy day. And I neglected to say when we began that Commissioner Weaver did tell us your regret that you couldn't be with us first thing this
yeah,
morning.
great.
So I realized, I should have told you.
Oh, no, that's great. I appreciate the commissioner doing that because she and I talked about it, and that's great.
She did. And we are so grateful for your leadership and your commitment to mental health, and particularly because I don't know that the Youth Risk Behavior Survey is something that a lot of people pay attention to, but your understanding of how important it is that it remain an opt-out in order for us to have.
Well, we need good information so that we can allocate our resources appropriately and see what's happening with our young people, right?
Yes, absolutely. So truly, thank you. And I think you saw a lot of hearts when talking about your cell phone initiative as well. So I think, you know, a lot of folks really caring about
I just got to work hard to get it over the finish line. So I appreciate it. I appreciate everyone on the call.
So thank you so much. We're really grateful to you. And we look forward to working with you over the next couple of years. And
excellent. So, thank you so much, Susan. Have a great day. Take care, everyone. Thank you.
Take care.
Bye.